aging is influenced by both genetics and lifestyle. One of the biggest contributors to visible aging is sun damage. One goes in for temporary fixes such as maybe fillers or certain other treatments which may not be the right choice. And that ultimately leads to a pulled up, tightened, artificial looking plastic face. Hello everyone, I'm Dr. Devayani Barve. Have you ever met someone who looks 10 years younger than their actual age? And on the other hand, someone who seems way older than they are? Today, I'd like to talk about the factors that influence how we age and what we can realistically do about them. Now, the first thing to understand is that aging is influenced by both genetics and lifestyle. Genetics certainly play a role. However, factors such as sun exposure, smoking, stress, sleep, nutrition, and skincare habits can have a significant impact on how the face and body age over time. One of the biggest contributors to visible aging is sun damage. Many people focus on skincare products but underestimate the importance of sun protection. Over time, UV exposure contributes to pigmentation, wrinkles, loss of elasticity, and uneven skin texture. Another factor is volume loss. As we age, the face naturally loses fat and collagen. This can lead to hollowing around the eyes, cheeks, temples. It's often one of the reasons people say they look tired even when they are well rested. Skin quality also changes with age. Collagen production gradually decreases, resulting in thinner, less elastic skin. This process is natural and happens to everyone. But the good news is that there are many ways to support healthy aging. A combination of skin protection, a healthy lifestyle, good skincare, and in some cases, preventive medical treatments can help maintain a refreshed appearance. Now, the most important thing I tell my patients is that aging is not something to fear. The goal should never be to look 20 forever. The goal is to look healthy, refreshed, and like the best version of yourself at whatever age and whatever stage of life you may be at. Another thing I'd like to highlight is that sometimes when skin changes have started appearing, one goes in for temporary fixes such as maybe fillers or certain other treatments which may not be the right choice. A consultation is very important in these situations. You go in for some treatment which you feel may give you a temporary fix, and then that ends up looking slightly artificial as we see certain overfilled faces or certain unsavory results, which again makes you feel that, oh, this is not looking good. And you go in for more and more and more treatments which are in the same pattern. And that ultimately leads to a pulled up, tightened, artificial looking plastic face. Now, though plastic surgery and cosmetic surgeons mostly have nothing to do with this, but the blame comes on plastic and cosmetic faces. So that's why consultations are very important, and approaching the right skincare and the right treatment for your skin and your age is very important. Thank you for watching.